May have noticed more people are reporting in sick, whether it's at work or at school. Just last week, we told you that JAG High School in Montgomery had to go virtual learning for several days.
COVID cases are on the rise. The CDC is reporting elevated numbers.
This spike comes as students return to class for the fall, and many people are expected to gather in large groups for football games. WSFA 12 News anchor Sally Pitts spoke with the Alabama Department of Public Health about the rising numbers.
COVID continues to make its way through communities across Alabama. Chances are you probably know someone who recently tested positive for the virus.
There's high activity in a lot of states.
Dr. Bernestine Taylor with the Alabama Department of Public Health says the number of positive COVID cases is increasing. She says while the symptoms may not be severe, it's important to test.
Some people don't really understand that COVID is still existent. People aren't being tested. So that means that they're in the community without knowing that they have COVID and they can transmit.
Dr. Taylor says the virus still represents a continued threat, especially to older adults and people with underlying medical issues.
Another important reason to be tested, if you're vulnerable and if you're at high risk for developing major complications, there are medications available.
If you test positive, Dr. Taylor says stay home until you are fever-free for 24 hours. Once you start going around people again, wear a mask for 5 days.
And we also should go back to our old standard, wash your hands, keep your hands out of your face, social distancing. That's been proven to be effective since the very beginning.
The Food and Drug Administration is poised to sign off on updated COVID-19 vaccines as soon as this week. If that happens, it would bring a new shot to the market earlier than last year's update. Sally Pitts, WSFA 12 News.
And those tips can help you avoid other viruses as well. Severe cases of COVID-19 appear to be linked with an increased risk of mental illness, including depression and anxiety. Researchers say the link between severe COVID-19 and mental illness may be a result of the infection itself or could also simply be due to the results of hospitalization.